Greetings to all. Welcome to Physio TV session. In the last session, we discussed about recent advances in electrotherapy. So today we are continuing the session with the next advances about extracorporeal shockwave therapy. So this is our second session of recent advances in electrotherapy. Today we are going to discuss about extracorporeal shockwave therapy. So our objects for today will be to describe the mechanical characteristics of extracorporeal shockwave therapy and to identify the musculoskeletal pathology that may benefit from extracorporeal shockwave therapy. Then we are going to discuss about the biological effects of extracorporeal shockwave therapy on all the soft tissue and the bony tissue. So we'll start with introduction, history, shockwave therapy production, then characteristics and energy production of it, then physiological and mechanism of action, its clinical application, then its adverse effects, and finally, what does the evidence say? So it is one of the very promising modality which has come up in the field of physiotherapy, and it is most widely researched rehabilitation modality used in physiotherapy clinics. And the number is increasing every day, the usage and the application. Every year, a lot of research is added into this. A majority of the research validates the effectiveness of the shockwave therapy, and the success rate is huge, 90% and more. So the meaning of the word extracorporeal shockwave therapy is extracorporeal is outside the body. Shockwave, which tells you that it is very intense and it has got a lot of energy with it and it travels faster than the speed of the sound. Now, if you see the mechanical, and it causes a well-controlled mechanical, that is controlled insult to the tissue, thereby it causes a micro trauma and healing followed by it. So if you see the shockwave therapy, it is a multidisciplinary device. Everybody knows it recently, but it was used previously by many orthopedicians, and now it has come up into the physiotherapy, and it's widely used in sports medicine, urology, and veterinary medicine. So its main assets are fast pain relief and mobility restoration. And it is known, we all know that it's a non-surgical therapy, and it is ideal to speed up the recovery and the cure variation and indications causing the chronic pain. So basically, it is targeting the chronic pain. So if you see the history of the corporeal shockwave therapy, it is in 1983, the commercial lithotripter came into existence with the help of the Dornier lithotripter, who first used it for the renal calculi, for treating the renal calculi. So then onwards, it got its growth, and then in 1985, it is also used for treating gallbladder stones, the bile duct, pancreas, salivary glands, and other areas and other organs. And these are all being treated by these acoustic waves. Now, during the next 10 years, shockwave machines were improved, trailed, and they have been improved and is used to treat a lot of orthopedic disorders. Now, first, we need to understand that whenever the word we listen shockwave, everybody thinks it is electric, but it is not electric, it is mechanical. These are the acoustic waves, sound waves. And they work by improving the blood supply to the injured area, reducing the pain, and also speeding up your body's healing process. Now, first thing is we should understand what is this shockwave therapy. So it is the wave or the sound wave which travels through most media with greater or higher speed than any other ordinary wave. So this image actually is a great image which shows you how a shock wave travels through the media and produces the acoustic waves or the shock waves. Now, when this shock wave passes through the different matter, the energy it carries is preserved, and that is responsible for its therapeutic effects. Now, it has got a large amplitude compressibility wave, and this takes form of a very sharp change in the gas property. So when it travels through a media, it brings changes in properties, and especially when it travels through the grasses, the properties of the gas changes. So this image is showing you the same thing. And if you see, we say that it has got a lot of power. Now, if you see, the power is measured in megapascals. And this is the graphical representation of the shock wave, which has got a very high amplitude, and it has got a pressure of over 100 megapascal. And it has got a pulse width of minus 60 dB. That means it is very small. The pulse width is very small. And there is a gradual drop, and then the wave is followed. Now, how much is this 100 megapascal? So let's try to understand. 1 megapascal is equal to 10.197 kilo force per square centimeter. That means 1 megapascal is equal to 10 kilogram force. That means 100 megapascal is exponentially the 1019 kilograms force. But okay, but here, just to compare, I'm comparing it with the pressure of a car tire. So everybody knows the car tire pressure. So 100 megapascal is 414 times more pressure than that in the car tire. So here just I'm trying to say how much force does a shock wave carry with it. And generally this is measured in bars. So 1 bar is equal to 14.5 pounds per square inch. So all the forces are in 1 bar, 2 bar, and 3 bars. The dosage is calculated 1 bar, 2 bar, 3 bars in the bars. If you come to the methods of production, basically we have 4 principles to generate shockwave therapy. The first one is the spark discharge. The second one is the piezoelectric. The third one is electromagnetic. And these 3 are used for producing focused shock wave. So here we'll try to understand in the next slide what is focused shock wave and what is radial shock wave. And with the image, you come to an understanding that the first 3 methods, you have focused shock waves. And in the last one, there is a radial shock wave where there is actually a dispersion of the waves. So we can consider the shock wave as an advancement to the ultrasound. So if you see the variation between the 2 different types, that is focused shock wave and the radial shock wave therapy. So the following are the differences. The first difference is maximal energy. So the maximal energy in focused shock wave is delivered at a focused point. For example, in renal calculi or kidney stones, they are focused on the target renal calculi where the shock waves are emitted, and they help in breaking down of the calculi. Very similarly, here in radial shock wave therapy, we have a radial shock waves where they actually disperse. And then if you see the mechanical effect, the highest pressure is at the target area, at the focused area. Whereas in radial shock wave, deeper they travel, lower the pressure will be there. That means the pressure increases from the surface, and deeper, as it goes deeper, its pressure decreases exponentially. If you see the pressure, the focused shock wave has a lot of pressure, that is 400 bars. Whereas the radial shock waves uses very less, that is 5 bars. And if you see the rise time of the focused shock wave, it is less than 1 microsecond. That means it is very faster. And the rise time, whereas in radial shock wave is 1000 microseconds. That means it is almost, the rise time is 1000 times less than that of the focused. And if you see the pressure of the wave relative to the time, this focus produces a large amplitude and then falls. Whereas the radial shock wave has small rise and then there is a negative phase which is followed. And the two diagrammatic representation, the focused always is represented in this manner, and on the right side we have the radial shock wave where it shows the dispersion of the waves. Now coming to the different generators, the commonly used generators are the air compressed one. First is the air compressed one. Here you can see there is a bullet in the barrel, and this bullet is accelerated by using the compressed air. So they use the compressed air to accelerate the ball, and this bullet actually strikes the end plate, generating a shock wave. This shock wave is generated here, you can see, and this requires an air compressor. And that's why this is using, since this is using the air for the producing and accelerating, the it is measured in bars. Coming to the second generator, we have this electromagnetic generator. The principle is very similar. The bullet strikes the barrel, but only thing is the bullet is accelerated here in the second one by the electromagnetic field. There is an alternating magnetic field which pushes or which drives the bullet to the end plate, and hence the shock waves are generated. In the previous one, there was a compressed air. In this one, we have the magnetic field which drives them. So since it is driven by the magnetic energy, it is measured in millijoules. Now coming to the principles of production, there are 4 parameters in shockwave. The first one is the focal volume. So here the amount of space which the shock wave induces the therapeutic effects. Like we have the magnetic field. Magnetic field can be felt in the area around the magnet. Very similarly, this is the focal volume is the area where you can see the therapeutic effects of the shock wave. Then we have the total energy. It is the amount of acoustic energy delivered by a single shock wave pulse. Next, coming to the energy flux, it is the measure of the peak pulse energy with the focal volume. So that means we are measuring the magnitude or the amplitude. Next, the energy flux density. So this is measured in the energy flux per square millimeter. So these are the 4 parameters which help the production of the shock wave. Coming to the energy flux density, it is graded into 3: low, medium, and high. Low is the one which has 0.08 millijoules per millimeter square, and medium is the one where we use 0.28 millijoules per square millimeter, and when it is over 0.28 millijoules per square millimeter, it is called as high. And we generally use for therapeutic purpose less than 3 millijoules per millimeter square, whereas greater than that is used in the other medical purposes like lithotripsy, etc. Now coming to the physiological effects and the mechanism of action. So basically we have 2, the mechanical and the physical. So if you remember the ultrasound physiological effects, it is also very similar. So here we have the mechanical, the molecular ionization, increasing the membrane permeability, the first one. The second one is the physical. This is again same in accordance with ultrasound. We have cavitation and microstreaming. So once the physical shockwave energy is supplied, there is a response from the tissue, which we call it as the biological response, where there is the release of the chemical mediators, that is endothelial nitric oxide, vascular endothelial factor, growth factor. So these chemical mediators will improve the blood supply to the treated area. Thereby there will be repair in the tissue and helps in regeneration of the tissue. Now this chart will help us to understand the approximate amount of the energy delivered. So as I said to you, the energy is measured here in bars. So we have 1 bar is equal to 60 millijoules. And very similarly, 2 is 90, 3 is 120. Then approximately if you see, if you're using an head of 15 mm, it is 0.12. And very similarly, 4 bars delivers 150 millijoules and 5 bars can deliver up to 180 millijoules. Now, coming to the cavitations, we see that whenever there is an acoustic wave, it creates compression and shear loads on the surface of materials it is delivered. So there is a rapid interaction between the compression and shear forces, which will result in cavitation. So once these cavitations are formed, we see that there are small vapor bubbles within the tissue, which lead to the formation of this cavitation. And this cavitation has the potential to damage the tissue. Now, a significant tissue effect is cavitation, which is the consequent to the negative phase of the wave. So during the positive waves, we see that there are very little cavitations formed, and these in the negative phase grow up and then can lead to the implosion, and which will release a lot of energy. So this image shows you the cavitation which is created by the radial shock wave, which we use in physiotherapy. So the left diagram shows you the early phase where you see very little or no cavitation, whereas in the second image you see these circular waves, which are the secondary shock waves released due to the implosion of the cavitation. And in focused shock wave, this is very clear. In the early phase, you actually see this compressed phase, and in the secondary shock waves cause circular waves in the media. So if you see the broader effects of the shock wave, you see destruction of the tissues, increase or improvement in the healing and blood supply in the tissues, and reduction in the pain. Now let us see the effects of the shockwave therapy. So first, what we see is there is improved blood supply, which is very important for the repair process of any tissue which is injured or which requires healing. So the application of the acoustic waves creates capillary micro trauma in the targeted tissue. Then, due to this micro rupture, there is a release of the growth factors such as the endothelial nitric oxide, the vascular endothelial growth factors, etc. And these process the arterioles. The arterioles are remodeled and grow new ones. That is, which we call it as the angiogenesis. And the new blood vessels will help in improving the blood supply, oxygenation, and thereby healing of both the tissues. There is tendons, muscles, bones, etc. Now, one of the other effects is reversal of the chronic inflammation. We know that mast cells are the key components of the inflammatory process. With the application of acoustic waves, their activity is increased. That means the inflammation is increased. And followed by any inflammation, there is healing and regeneration. Next, the stimulation of the collagen production. So collagen is necessary for any repair process in all the musculoskeletal tissue. Shockwave is known to accelerate the pro-collagen synthesis and the laying of this collagen fibers, which makes them more dense, stiff, and firmer structures. Shockwaves are known for the dissolution of the calcified fibroblasts. So we know that whenever there is a micro tears in the tissue, there is calcium buildup in them. These acoustic waves break up the existing calcifications, and this decalcification of the calcium can treat the tissues like tendons. And of course, our lymphatic system will remove the calciums that are removed from the tissue. Next, the pain. Pain is another indication or another reason for which we are using the shockwave therapy. And we know that the neuropeptide substance P is generally associated with this pain. And we see that after the treatment with extracorporeal shockwave therapy, there is a reduction in the substance P stimulation. Then, due to which there is a decrease in the substance P, histamine, and other nociceptive metabolites, which help to inhibit the inflammatory process. The acoustic waves, which are generated by the shockwave therapy, are known to lower the substance P concentration and thereby reduce in pain relief. Shockwaves are used for treating trigger points. So here we refer this pathologic process as the metabolic crisis. So when the shockwaves are delivered, then there is unblocking of this calcium pump and reverses the metabolic crisis, thereby release the myofilaments and trigger points. Next, shockwaves are known for the activation of the osteoblasts. So the study done by Chen et al. Shows that there is increase in the levels of the osteocalcin and bone-specific alkaline phosphate after the treatment. So extracorporeal shockwave is known to promote the bone marrow and stromal cells growth. Now coming to what is the dosage. So we have the following things. So when we can apply the energy in millijoules per millimeter square. So we count the number of shocks, the number of treatment sessions, and number of repetitions. So the shock waves which are delivered usually range between 1000 and 2000. Some researchers have tried as few as 100 and 500, and they found that 500 are more effective than 100. But the classical, the most convincing one is 1000 to 2000 shocks a session. And coming to the application and the repetition and how many number of sessions. Generally, most clinical research has showed 3 to 5 sessions at low energy levels for majority of the patients and 3 days for 3 weeks. And coming to the dosages, generally we use for healing and pain relief. The dosage for healing is for a head of 15 to 35 mm head, we use 60 to 90 millijoules, which is more or less equal to 1 to 2 bars. And the frequency used is 10 to 16 hertz. That means in a second, there are around 10 shocks delivered, 10 to 16 shocks that are delivered, and 1000 in a spot. Whereas if the area is larger, you can increase them up to 4000. And this is every 7 to 10 days is given. And 4 to 6 sessions are likely to be given. And for pain relief, 6 to 35 mm heads are used, and the dosage delivered is same around 60 to 90, but the frequency is slightly higher, 15 to 30 hertz. And in a spot, more number of shocks are required. So it is 1500 to in a small spot and 4000 in larger area. And this is also given every 7 to 10 days, and generally it requires 3 sessions. Now, the International Society of Medical Shockwave Treatment has given us a list of approved treatment indications where actually the shockwave therapy is known to be very effective. So that is, it can be used in all the chronic tendinopathies, the plantar fasciitis, where there is no heel spur. Because these shockwaves can injure the spur, which may cause further inflammation and pathology. Whereas it is also known for Achilles tendinitis, the tennis elbow, rotator cuff injuries, and especially the calcified, whether there is a calcification in the rotator cuff tendons. Then we have the patellar tendinopathies. Then in the trochanteric pain syndromes, bone healing, stress fractures, and avascular necrosis, and also osteochondritis dissecans. Now, commonly tested clinical uses are all the tendinopathies, which are used where their primary aim is for healing. Then ulnar epicondylopathy, burns, adductor syndrome, the Pes ancinators syndrome, muscular pathologies, then peroneal tendon syndrome, myofascial syndrome, and impaired wounds. There are some exceptional indications which are where there a lot of research is now going on in using the extracorporeal shockwave in spasticity, the osteochondritis dissecans. That is only the early stage where there is pre-skeletal maturity and epiphysiitis, then the Peyronie's disease. And coming to the contraindications, since the shockwaves carry a lot of energy, they cannot be used anywhere near the eyes, over the major blood vessels, over the open wounds, on the implanted devices, over the brain and surrounding major nerves, epiphysis, over the infective sites, the malignancy, the pregnancy, the joint replacement sites, and also the sites where the corticosteroid injection has been given, and in the clotting disorders. Now coming to the side effects, because the corporeal shock wave produces inflammation, there is, you can see the inflammatory signs, there is a redness, swelling, there is sometimes for momentarily increase in the pain, sometimes you see the hematomas, and they generally subside in 3 to 5 days. Now coming to the evidence, what does the evidence say? So we see that there is one study which is done by Liao CD and the team. So they studied the clinical efficiency of extracorporeal shock wave for knee OA. It was a systematic review and meta-regression of randomized controlled trials. In this study, the study included 50 trials and overall 4,844 patients with the median, and it has a good Petro score of 6. This meta-analysis results revealed that there is overall significant effect favoring the shockwave therapy on the treatment rate, in the reduction of the pain and WOMAC score. So the follow-up duration, energy, flux density were independent significant predictors of the shockwave therapy. And it is found that the shockwave therapy is beneficial for knee OA. The shockwave dosage, particularly the energy level, intervention duration, may have different contribution to treatment efficacy. In another study where efficacy of shockwave therapy for lateral epicondylitis is done, it was a systematic review and a meta-analysis done by the Gowen Yao and the team. So it included 13 articles and 1,035 patients, of which 501 underwent extracorporeal shockwave and the 534 underwent the other treatments. And the results of this meta-analysis showed that there was improvement in VAS and the grip strength. And also based on the evidence, the extracorporeal shockwave was effectively relieving the pain and the functional impairment, and better, and it was found to be overall better and safer than the other modalities. So hence, the extracorporeal shockwave is very effective in the soft tissue healing, the tendinopathies, and also in this study showed that it is very good in epicondylitis. So these are my references. Thank you. I would like to join you in my next session of advances in the electrotherapy. Thank you.